The fuck? Just crashed. Oh no, it's going.
Welcome, everyone, to A Mexican Crossing Lines with your host, Gomez-Schempp.
And Duke Gomez-Schempp.
You're listening to 88.1 FM, KPPPLP Fargo Moorhead, where we are adding local color to your airwaves. And tonight, I am going to talk about the enemy within, I guess, if you will. Over the last few days, as we have not had a task force press conference really from anybody at the White House in the last couple of days. The president has been traveling to different places. Today, he was giving a speech from, not really sure where, a company I think he went to visit. And meanwhile, there have been congressional hearings. We've had doctors Fauci and others from the CDC and the FDA testifying before Congress. And we also today we're hearing from Dr. Bright, the whistleblower who was allegedly, according to him, fired from his position for he claims that he was kicked out because he did not want to support putting out hydrochloroquine, something that the president felt was an important step. And there was a lot of other things that actually involved the reasoning behind his coming to this impasse. And I think things got more and more contentious over time. There was 4 hours worth of testimony. I scrubbed through a lot of it, most of it, I think, and it was quite eye-opening, I feel. It was quite eye-opening. I'm not going to summarize everything that was said, but you couldn't listen to the testimony of the efforts made by Dr. Bright, if his testimony is true, on how he was trying to sound the alarm, if you will, about the needs for PPE, the acquisition of the virus from China so that we could begin working on a vaccine, and also getting different types of treatments and making them available, fast-tracking them in order for those to be used. But what I came away with was a sense that we might very well be our own worst enemies when it comes to this battle against coronavirus, because we don't seem to have a plan. We can't seem to agree on a plan. Even the president's own guidance on reopening has been largely ignored in many states. And the outcomes that we're seeing, the response that we're seeing, especially at a local level, in terms of people following the guidance, is proving that we have a lot of knuckleheads out there, a lot of people that are willing to infect and kill others because they can. Spitting on food, spitting on people, coughing on people, assaulting people, many times simply for being asked to wear a mask in businesses that are being told by their governors that they need to implement and enforce mask wearing inside of stores. So I feel that our biggest enemy really might be us, and that the biggest problem that we have in fighting against the coronavirus is hiding in plain sight. We are the enemy, Duke.
Yes, we are. Yes, we are.
This is the sad conclusion I have drawn today after looking at and after listening for the last few days at what's going on in this country, the division, the anger that is playing out, and understandably, people are very frustrated, and many people are getting deeply depressed because they're losing their businesses. Many of them are losing their health care, their health. So we're going to go over all of that on today's show, Hiding in Plain Sight. But first, I want to thank all of you for supporting our station's work, for following us on social media, and of course, for your comments and questions.
Yes, welcome to the show this evening. You know, we've been watching a lot of videos showing people at public places and things, and just flying off the handle, flying off the hook. People are so edgy. Try not to be so edgy. We can't play most of them because there's too many swear words. Since we're airing on the radio and multicasting on YouTube and Facebook, it's just too much work in the day to take all those words out and bleep them all out, but we do a little bit. If you would like to get a hold of us, leave us a message on our call-in message line, 701-566-0917, 701-566-0917. You can also email us, Cindy at kpppfm.com or Duke at kpppfm.com. Go to Facebook, 88.1 FM, Fargo Moorhead, Mexi-Can, and the People's Press Project, as well as the web at kpppfm.com. You can also go to our website and make a donation to our nonprofit organization to make sure we continue programming and and help support us with the programming we're putting out tonight and will continue to do.
Now, Duke, I want to start off with the numbers, and we have to remember that each one of these numbers represents a human being, a human life. Yes. We are now at 4,437,442 confirmed cases worldwide, and at 302,025 global deaths.
Oh, boy.
Here in the United States, we have 1,451,000 confirmed cases and 86,891 deaths. 317,054 cases are recovered. So, fortunately, we have seen that 80+% of people are not going to get seriously ill or die from this disease, but there is a percentage, albeit a small percentage, 15% or so will need further serious follow-up, maybe even hospitalization, and a even smaller percentage of that will get very seriously ill, need to be put on ventilators, and even then may die. So a lot of folks feel like, hey, what's the big deal if such a very, very small percentage of the folks that get this are going to get seriously ill and die? Why is the entire rest of the country and the entire economy suffering as a result? Well, For one reason, you don't know who that 1% is or that 2%
Exactly.
is. It could be mostly elderly people, like we've seen so far, but we've also found other related illnesses that are giving people heart attacks, embolisms, that are giving children toxic shock syndrome like symptoms and even killing some very young children. So we cannot be reckless, we can't be careless, and there are reasons why there are measures being taken in this going back to business plan that include social distancing, especially when you're in enclosed spaces, and mask wearing. And also, there's the fact that we continue to see a rise in cases.
Yeah, that's for sure.
In fact, sadly, North Dakota is now one of only 8 states that has increasing numbers in their state. So, how are we doing in Minnesota?
Well, not so good. We had an additional 25 deaths in the past day. The total positive number is 13,435 people. 523 new reported cases in Minnesota. And the deaths are at 663. Like I said, 25 more people passed away from COVID, but most of the deaths are still nursing homes, 537. So it's like 90-some% of the deaths in nursing homes are from elders in nursing home. And our county, Clay County, actually I put up a new map that has it has all the numbers. We're at the one that says 273 up in the upper left, corner here. And if you look around us, it's there's not as many deaths. And the reason we're so high is because Fargo's on the other side of the river.
Oh,
That's really the reason why. And in Fargo, North Dakota, Cass County, I guess, there were no additional deaths in the past day, which is fortunate, but there was 57 new cases in Cass County. And they're basically the total positive in North Dakota is 1,712. So it's like those numbers aren't good. Those numbers are going up. They're going steadily up, and it just again, I think I know it's because of people not paying attention and thinking that life is normal, and they do things and don't think about it and refuse to do things. These businesses are opening because people need to make money. People need products. They need these different things that they couldn't have, and just people are doing a lot of things that put a lot of people at risk.
one of the things that was really striking to me about all of the things that I heard is the care that we have given to procuring PPE and making sure that our healthcare employees, our frontline workers, doctors and nurses, EMTs, paramedics, the people that are, transporting sick people, having direct contact with people that are COVID positive and that are having to intubate those folks or, share that very close contact such that they could then contract the disease. And this part of the testimony was one that really stuck out to me because of how procuring PPE at such a late date, not having the proper amount of stockpile, and also then having to hurriedly procure PPE from other countries has affected our healthcare workers and is still affecting them to this day. Take a listen to Dr. Bright's testimony on masks.
Of respirators in January. Is that right?
We understood America would face a shortage of N95 respirators for a pandemic response in 2007. And we have exercised and known and evaluated that number almost every year since 2007. It was exercised even as early as 2019, August, in Crimson Contagion, that we would need 3.5 billion N95 respirators in our stockpile to protect our healthcare workers from a pandemic response.
And you sounded the alarm repeatedly but were ignored by the senior leadership at the Department of Health and Human Services. Please explain what steps that you took and the response you received.
We knew going into this pandemic that critical medical equipment would be in short supply. I began getting alerts from industry colleagues in mid and late January, telling me that from an outside view, from the industry view, that the supply chain was diminishing rapidly, telling me that other countries that we relied on to supply many of these masks were blocking export and stopping transfer of those masks to the United States. I learned that China was trying to buy the equipment from the United States producers to have it shipped to China so they could make more. In each of these alerts, and there were dozens of these alerts, I pushed those forward to our leadership in ASPR, to Dr. Cadillac and his senior leadership team. I pushed those warnings to our critical infrastructure protection team. I pushed those warnings to our strategic national stockpile team, who has the responsibility of procuring those medical supplies for our stockpile. In each of those, I was met with indifference, saying they were either too busy, they didn't have a plan, they didn't know who was responsible for procuring those. In some cases, they had a sick child and would get back to it later in the week. A number of excuses, but never any action. It was weeks after my pushing that finally a survey was sent out to manufacturers or producers of those masks, a 5-page survey asking producers or companies if they actually made those masks.
In your whistleblower filing, you discuss a February 7th meeting of the department leadership group at which you urged the department to focus on securing N95 masks. Can you describe what happened at that meeting?
They informed me that they did not believe there was a critical urgency to procure masks. They conducted some surveys, talked to a few hospitals and some companies, and they didn't yet see a critical shortage. And I indicated that we know there will be a critical shortage of these supplies. We need to do something to ramp up production. They indicated if we notice there is a shortage that we will simply change the CDC guidelines to better inform people who should not be wearing those masks, so that would save those masks for our healthcare workers. My response was, I cannot believe you can sit and say that with a straight face. That was absurd.
In fact, it took 3 months from your initial warnings until mid-April for the federal government to invoke its authority under the Defense Production Act to require the production of millions of more N95 masks. And even then, the administration required the production of only 39 million masks, which is far fewer than you and other experts said that we would need. What was the consequence of this 3-month delay and inadequate response? Were lives endangered?
Lives were endangered, and I believe lives were lost. And not only that, we were forced to procure these supplies from other countries without the right quality standards. So even our doctors and nurses in the hospitals today are wearing N95 marked masks from other countries that are not providing the sufficient protection that a U.S. standard N95 mask would provide them. Some of those masks are only 30% effective. Therefore, nurses are rushing in the hospitals thinking they're protected, and they're not.
Thank you for.
Wow.
That is shocking.
It is.
I don't even know where to start. I mean, the first thing that's really startling to me, and I think that it kind of speaks to the disconnect for people about wearing the masks.
Yeah.
Is that he told someone that they needed to procure more masks, and the response was that basically that they should give some kind of guidance to people about not wearing masks so that the healthcare workers could have them.
Yeah.
And he said, are you kidding right now? Which would indicate to me that N95 masks are definitely protecting masks that could help every single American. If every single American could even get their hands on one,
Yeah.
which we can't because we have to reserve them for the healthcare workers. But then also, on top of that, the fact that the masks that many people are wearing are 30% less
Yeah.
effective,
Or just 30% effective.
or 30
That's
is
70% less effective.
are only 30% effective at protecting them from the coronavirus, and those medical staff people don't know that.
Mm-hmm.
They think they have protective gear that is keeping them 95% safe, not 30% safe.
Mm-hmm.
And I don't know how we can accept that with a clear conscience in this country, that this is the first I've heard of this, that we're sending our healthcare workers. I have friends and family that are nurses and EMTs and medical staff, and the thought that they're not fully protected and that they're being given substandard equipment to go into battle with is terrifying. And it's so heartbreaking to learn this. So I don't know how we can, come back from that, lack of information. How do we get to a point where we understand how best to protect ourselves? And I have a question, and I really want to know what people think about this. Do you, regardless of how you feel about the coronavirus, I mean, I know there's still people out there that don't think it's real. Maybe that's just because they still haven't had anybody close to them get ill or get seriously ill or die from the coronavirus. I'm not sure why they think it's not real. But for the rest of the people that can accept the reality that the coronavirus is real, do you believe that we should have any rules at all to protect people that could get seriously ill or die? Because if you don't think that businesses have the right to tell you to wear a mask, the implication of that is that you don't believe that elderly people and people with underlying conditions should be protected. It's every man for himself. And if those people are afraid of dying, they should stay in a bunker and never see the light of day again.
Or any other people.
And if that's how you feel, that's fine. That's your opinion. You can state it. I'm just wondering, because what do we owe our elderly population? Do we owe them any safeguards at all? Are they owed any kind of protection? I know that some stores set store hours that are specific for elderly and immunocompromised folks to go shopping. But I've also seen stories online of people that don't fit those categories going shopping at the same time that the elderly and the sick are, shopping in relative safely and not wearing masks or not wearing masks properly. So the question is, do we owe vulnerable populations any safeguards? Any at all? Should businesses be required to do anything? Make people wear masks, make you do hand sanitizer, distance you inside of their establishment? Do they have a right to do any of it at all? What are your responses? I'm going to read some of the comments.
Good.
Jeannie says, California is trying to sneak an increase on the ballot. It was on last ballot and did not pass. They are trying again. The taxes are already high here. That's why everyone that can is leaving California. I would leave if I had the money to leave. And this was also in response to Alicia. Thanks for your comment. Alicia Martinez Velasquez says, here in Nashville, they're trying to increase property taxes by 30 to 32%. It hasn't passed yet, but our landlord sent us a notice of a 75% increase already.
Wow.
Really? That's, land grabbing, right? They're going to try to...
Well, there's no rent control. A lot of the housing organizers especially in bigger cities, would negotiate that the landlords couldn't raise the rent a certain amount, and if there's no protections like that, landlords can, when your lease is up, they can decide to charge whatever they want for the place you're staying. If you can't pay it, you don't get it. I mean, it's capitalism, and it's for-profit, housing.
Well, I think that Wisconsin also has opened up its bars, and according to Sergio, they're full of people. So more and more people are going to be going out and enjoying the new business openings.
Yeah.
And here, this meat packer, many of which have reopened despite not having testing available for their workers, has now discovered that at least 15,689 workers have tested positive for COVID-19 and 65 workers have died.
Wow.
So now that we are doing more testing and more tracing, we are finding a huge number of people. That's another one of our hotspots in the United States, right? The key to slowing down the pace of contagion and death is being able to track, trace, and test, right?
Yep.
Being able to protect people also is important. That's why we're wearing the masks. But being able to test and then trace. I've already shown you on my show how there are people that are not interested in getting tested and not interested in cooperating with tracing. The meatpacking industry is one of those cases. They didn't really want to find out how many people were sick. And according to this Rachel Maddow tweet, JBS, one of these meat packers owned by Brazil, previously had provided free testing to workers who showed symptoms of COVID-19, only those showing symptoms.
Yes.
Union leaders have now been demanding tests for asymptomatic workers as well. Guess what happens? Now that they've been testing everyone, they found a lot of new cases. 316. It jumps to 316. And 6 deaths reported at JBS alone.
Wow.
So now they're tracking this with this map. You can take a look at the map that is tracking all of the different meat packers. And from what I can see on the map, you know, these little dots on this map go from light yellow, which is no cases of COVID, no deaths, to the dark purple, where you have hundreds of cases, right? So you can see that, you know, there's a lot of red. There's some orange. Very, very few yellows, really. A lot more darker colors, which indicate more contagion and more deaths. So if you want to check out the meat packing mapping, you can go to www.thefern.org and check out the mapping for COVID-19 in meat and food processing plants. I wanted to share what the president said today, and this again goes to this mixed messaging, because one of the things that has kept us safe is social distancing. And in this visit that the president made today, he, gestures toward a time with businesses now reopened where we won't have to social distance anymore. Question I have is it too soon? Take a listen.
Thank you. All that social distancing. Look at you people all spread out 6 feet. That's pretty impressive. But we like it the old way a little bit better, don't we? And we'll be back. We'll be back to that soon. I really believe it.
Wow.
What do you think?
It's like he's mocking. He's just mocking. And it's hard to take that man seriously these days. You know, well, I don't know, myself, not much ever. But one of the things you were saying earlier, do we really care about the elderly? I think we have lacked the leadership that gives us, straight answers to questions and direction. Look at the mask thing, wear a mask, don't wear a mask, stay at home, don't stay at home, go to work, don't go to work. It's very confusing messaging back and forth.
It is. And I think that what we need right now is clarity so that people know what's right and what isn't right. I think that we should be pushing the education that we failed to do in January and February of wearing masks. I mean, we got the hand washing down, right?
Yeah, we got
all
that.
figured out we got to wash our hands. We have to stop being pigs and wash our hands and do it correctly for the right period of time. Scrub, get under your nails, all of that. We have to continue the social distancing. We may not be able to have the kind of social connectedness that we had in the past, whether it's shaking hands, hugging, kissing on the cheek, all of those things for a long time. How long? Until we have beat this disease, until we have found a cure, until we have found meaningful treatments, and we have the medicine and the distribution power to make sure that those treatments are available to anybody that needs them, until we have the testing available, until we can feel safe being in establishments, in restaurants, in bars, in stadiums. And until then, we have to start to figure out ways of adapting and being able to live, but doing it safely. Let's take a look at testing cases. This is what the president said.
Forget, we have more cases than anybody in the world. But why? Because we do more testing. When you test, you have a case. When you test, you find something is wrong with people. If we didn't do any testing, we would have very few cases. They don't want to write that. It's common sense. So we test much more, many, many times. South Korea, you hear about? I spoke with the president of South Korea, spoke with many different presidents.
Why?
So, correct me if I'm wrong, but what I heard the president say is that if we didn't do tests, we wouldn't have these ugly numbers.
Yeah.
Look, not doing tests is not going to make COVID go away. Mm-hmm. Not doing tests isn't going to make people less sick or resurrect them from the grave. So it's like the equivalent of hiding your head in the sand because you don't like what you might see. And that isn't the way to find out, to deter, to stop a deadly virus. What we need to do is find ways to find it, trace it, isolate it, and get rid of it, cure it.
Yep.
That's what we need to do. And until we can find a way to do that effectively across the board, we have to be very, very creative. I also want to acknowledge the difficulty, the stress, the depression, the poverty that many people are sinking into, and of course, the daily drone of numbers, deaths, sadness. It's a lot to take. I know that people are hurting. I know that people are suffering. A lot of people are having mental breakdowns. And it's worth noting that we need to step up our care in that department as well. Here is a recommendation about mental health illness around the globe.
Headlines about mounting death tolls and disease, fake news and political battles, people losing their jobs, economic recessions hitting across the world, people stuck indoors, and people facing it on the front lines.
We cannot take it anymore.
It's a depressing combination, of course, and the United Nations is asking governments that as the pandemic crisis drags on, not to forget about the mental health toll that this is having on many, many people. It needs to be front and center in the response, they say. Devorah Kestel is the director of the World Health Organization unit that deals with mental health, drug, and alcohol abuse.
We have seen in the past that similar cases of economic crisis have increased the number of people with mental health issues, leading to high rates of suicide, for example, due to the mental health condition or the substance abuse, for example. Some surveys that were done in Canada, where 47% of healthcare workers reported need for psychological support. 47%, so almost half of them. In China, we have different figures for depression, 50%, anxiety, 45%, insomnia, 34%. The numbers are there, and these are just preliminary, we know.
The WHO's report released on Thursday also shows high levels of distress in the United States' general population, about 45% of those surveyed. Children and frontline workers, they say, are among the most vulnerable groups. Reuters has itself met many doctors and nurses across the world experiencing combinations of panic, grief, nightmares. The WHO did outline steps that governments can take to help ease this burden, including addressing past underfunding of psychological services and pushing online resources, such as video conferences with therapists.
Wow.
Yes, I mean, people are going through an incredible amount of stress. And we've seen the steady parade of healthcare workers that have broken down and talked about the conditions of their job, the sadness that they're going through, the feelings of just impotency, at watching what's happening. And we've even seen doctors that have committed suicide as a result of this. And I know that other frontline workers are under an incredible amount of stress, business owners, figuring, if you're the head of a family, how are you going to put food on the table? Everyone is having very, very high stress levels right now. But in addition to putting mental health care front and center, we also have to focus on how we can keep people safe. And I think that goes back to being our own worst enemies. We have to do the simple things like social distancing and wearing our masks. In some cases, people really can't stand the sense of asphyxiation they get from wearing a mask. In this case, one woman found a way to solve that problem and still wear her mask. Take a look.
Hello. How you doing?
Pretty good. I need 10 on pump 1, please.
Where'd you get that mask from?
Well, since we have to wear them and it makes it harder to breathe, it just makes it a lot easier to breathe.
Cutting it? Yeah, I'll do that too. Thanks for the advice. Appreciate you.
Just cut a hole in the middle.
She cut a hole because she couldn't breathe through it. Kind of defeats the purpose.
Yeah, it totally defeats the purpose. And I know they're not comfortable, and you might feel like you look silly, or you might feel like you look weak or something like that. It's not. It's not meant to make you feel silly or look weak or look scared. Wearing a mask just means that you're respectful of the business that asked you to wear it, that you're respectful and that you're mindful of the vulnerable people that might be in that place of business or at the location where others are congregating, that you're protecting by wearing a mask. It's not that big of a deal. Somehow, though, people still find it a little bit too much to ask. And also, people have just lost their minds in terms of the patience that they have with retailers. We've seen video after video of story after story of people assaulting guards, killing guards, fighting with business owners because they don't want to wear a mask. And over the Mother's Day weekend, over the Mother's Day holiday, I'm sure many of you probably had the same idea of doing a special dinner. One of my favorite places to go is Red Lobster. I love the crab legs there. And this year, Duke and my family made me crab legs here at home. We had Red Lobster at the house,
We made the biscuits, and we ordered from a grocery store frozen crab legs. They delivered them to our doorstep. It was about half the price of going to Red Lobster, but still an expensive meal. But it was still Mother's Day, so
yes, and
had to do something special.
I love the lobster legs that they have. Take a look at this other photo. Oh, that's Duke's legs.
Oh, aren't you funny?
Those are the Duke legs.
Hey.
I like those. Those were a special Mother's Day present for me too.
Yes, and that is not underwear. Those are shorts from Guatemala. And I'm in the middle of my Section 8 apartment in my underwear.
Well, let me just share with you that a lot of folks decided they would order from the restaurant. And unfortunately, they were overwhelmed at many of the Red Lobsters across the country on Mother's Day. In this particular Red Lobster I'm going to share a video from, people had to wait 3 hours. One shopper becoming so angry, they were all waiting outside, by the way. They were not allowed inside the restaurant. Curbside pickup and carry out is what is allowed in a lot of places. So this restaurant is not open for business. Customers cannot come inside. This woman decided to go inside and demand her refund. This is what happened.
Let's fight now. Anybody got time? Call 911, somebody. Get out! Get out! Get out! Get out! Get out! No! Stop it! Hey, what's get my mother money back! You will get it! Get out! Get out! Get this off me! No! Get out! Get out! Stop it! Get her off me! I am coming in and I'm getting my refund! Where's the key? Right next to the computer.
That guy's having to hold her back. They got 3 people at the door, 3 employees. And they told her they just need her name. She's still trying to push her way
Let
in.
me show my bill to get my refund. All we need is your name. That's all we need. Kathy Hill.
Kathy Hill. Okay, we got your name.
When?
You can leave now. You will get your refund. It must have been on her card or something. So all they have to really do is reverse credit.
Oh, just hit the guy.
She hit the lady and the guy. Now they pulled down his mask. That other lady's mask came down. If any of those people has COVID,
Let go of her hair. Let
Yeah.
go of her hair. Stop!
just
Jeez.
Stop! That is enough. I was assaulted and I have a whole crowd to you hit her. She's been shoving up on me the whole time.
the Red Lobster is standing with their employers, with their employees on this dispute.
I'm waiting for 3 hours for food.
But they said that they do not condone any violence. What's really incredible about this video is that this video was made public by this woman's crew, friends, family, I don't know who was with her. It wasn't the employees that put out this video. Her friends and family put out this video.
Wow.
I can only assume they thought it would make people mad at Red Lobster.
Well, it didn't work. Weren't doing anything wrong, I could see.
And the thing I worry about, folks, is when you look at something like that, I think it's, bad enough pre-pandemic with people that are, in a huff or they're angry about having to wait or not having the, whatever toilet paper or meat, whatever it is that they wanted from the store or from a restaurant. But on top of that, to be assaulted during a pandemic, but by a person that's not wearing a mask, is screaming in your face because they want their Red Lobster. I mean, folks, I love me some Red Lobster, but I did not know that it was that good. Like, you can make that stuff at home, folks. And none of that had to happen. And I feel like that's why our enemy is hiding in plain sight. We are hurting each other over silly things like that, over whether or not people want to be masked or traced. And frankly, what do we think is going to happen? I mean, when they reopen other countries for travel, and those countries require you, when you come in, to notify them that you're visiting from the United States, the capital of COVID cases and deaths right now. Other countries are going to be concerned about letting Americans into their country, especially if you might have COVID. In fact, in the UK, they are requiring any visitors to register, to download this COVID tracing app and notify authorities. Authorities want to make sure that they know that any visitors to the UK will be tracked in case they have COVID.
Wow.
So if you are traveling to another country, now you're going to go to a completely different country with a completely different set of rules. If Americans don't want to wear a mask and don't want to be traced if they've been in contact with someone with COVID on American soil, what can we expect when the borders open? Mm-hmm. Are we going to be exporting this disease to other countries because of our fierce independence? Will other countries allow us to do that? I don't think so.
No.
I think if you try to pull that in another country, they're going to put you in jail. They're going to force you into quarantine. I mean, we can't just do what we want. I think folks have to realize that just like governments of the states can tell you that you have to follow certain health guidelines during a pandemic in order to save lives, businesses can tell you that you have to follow certain health guidelines inside of their privately owned businesses in order to save lives. Other countries can also require you to follow health guidelines in order to save lives. Mm-hmm. That's what it comes down to, guys.
Yep.
And we're still going to have people, let's go to the next graphic here. We're still going to have people that are COVIDiots that feel like it is their right to assault. It is their right to spread disease. And this woman from the UK did just that. She spat in the faces of 2 emergency workers while claiming that she had coronavirus. And she's facing jail time. Sarah Clarkson Rose also spat at 2 police officers. She pleaded guilty to these attacks in court.
Wow.
By the way, this comes just days after the death of Belly Muhinga, the transportation worker that had a man with COVID spit in her face and then tell her he was COVID positive. She died about a week later from complications of COVID. So folks are very happy that the courts took the offense seriously and that they punished her, that they gave her serious punishment, which includes jail time, because of the flagrant disregard with which this woman treated 3 workers on the front line who were protecting the community at this crucial time, meaning the pandemic.
Yeah.
And just so you know, this woman was in jail and said that she needed to go to the hospital because she was having symptoms of COVID. When she was in the hospital, they didn't find anything wrong with her. She spat on a nurse, and then she spat on 2 officers before they got her back to the jail.
Oh boy.
So, yeah, don't be a COVIDiot.
Mm-hmm.
Meanwhile, if we are able to act civil to each other, to follow basic rules, decency rules of wearing a mask when going into other business, maintaining social distancing, and just staying calm, we're going to make it easier on law enforcement because they don't need this headache right now. They don't want to have to enforce these rules. And in many cases, it's almost impossible. Take a listen to this officer complaining about the social distancing rules that he now has to enforce.
So yeah, we're talking about the new reinforcement from the county here about street parades. What is the police, San Jose police doing any differently? What's your first reactions to this?
Well, the first reaction to this is incredibly frustrating. Since this began, it seems like the goalposts are not just moving for our community, but for law enforcement. Since day one, these orders have been ridiculously difficult to enforce. But now, I don't know how any police chief in this county can look at their community in the face and say, while people are being released out of jails on 0 bail, serious criminals, that now we're going to stop people from holding signs, driving around, and wishing individuals happy birthdays or happy graduations. I don't understand. I certainly can't look at my community credibly and tell them that.
So he's talking specifically about those little parades that people have been doing for birthdays.
Mm-hmm.
You've seen them in front of nursing homes.
Yep.
You've seen them for graduations. It's one of the only ways that people are managing to still have some kinds of celebration
And contact.
contact, even at a distance from their loved ones. What do you say about this? Do you think that orders from local law enforcement to stop people from doing that are fair?
Well, the ones I've seen, the people actually aren't doing it right. I mean, if you did it right, you'd be 6 feet apart. And, why go out and do anything that actually endangers yourself? And the thing is that people, they come along, or the neighbors come along, and they walk right up to the other neighbors, and everyone's forgetting that they're in closer proximity than they should be. I haven't seen one that, one looked like it was just a whole family that was all living together, and they went out and they stood outside of a window, and that, but at the same time, most of the ones I've seen people do include other people, and it lacks safety. To have law enforcement go break those up, I think that's, we've got to teach people to start doing stuff right in the first place. And I think just enforcing the rule and punishing people for doing it wrong is not the way to teach people to do it right.
Maybe we need some of those robots that they have
Yeah.
in South Korea that walk around and go, "You're too close together."
Yep, exactly.
I don't know. I don't. We have to find balance here. Obviously, we
That's
need
true.
to find some kind of balance. Our law enforcement doesn't need to be going out and doing that. They don't need that. Yes, Mike, they do not need that extra contact. Law enforcement, it's
That's
not
right.
their fault. They don't need this extra headache. So we need to stop acting like, we're children and figure out a way of doing things and doing them correctly. Also, having said that, how do you teach children to not run up to grandma or grandpa?
Mm-hmm.
How do you teach, it's our muscle memory is geared toward hugs and handshakes and wanting to be close together.
Yeah.
It's going to be rough, folks. I'm not going to lie to you. It's going to be rough. We're going to have to figure out a different way. And it's not going to be forever. It's not going to be forever. There is treatment on the way. There is a vaccine on the way. Is it going to happen in a week or a month? No. But it's we're working toward that. And in the meantime, we have to figure out a way of doing right by everyone in the community. And so, we have to figure out how to do our celebrations differently, how to interact with each other differently, how to do our shopping differently. Everything is going to have to change. One thing I can tell you one thing we're not going to do. We can't have any more of these COVID catching parties.
Yeah.
Yes, that's still a thing that's happening. Here's a headline for you. Morons are hosting COVID-19 parties to intentionally catch the virus. This is still happening. Some people are hosting these parties in an effort to intentionally get the virus and, get over with it. And how they found this out? They have contact tracers. I told you this is going to be a job of the future now.
Mm-hmm.
Contact tracers are contacting these people to find out who they were with, how did they catch the virus, and they're finding out, 25 of the people that they found with COVID came from one of these parties.
Mm-hmm.
So 25 people contracted the virus. They're people purposely out there trying to create hotspots, purposely out there trying to create sickness for themselves and for others. Do you remember that story of the woman whose name we didn't share on the radio, but one of the people that that recently contracted COVID from a roommate?
Oh, yes.
You know who I'm talking about, right?
I know who you're talking about, yep.
Anyway, this person was not taking the virus seriously. She was very upset, in fact, that she was being so careful not to catch the virus because she was very scared that she would get very seriously ill whereas her roommate didn't feel he would get seriously ill, which is why he wasn't taking it seriously. Guess what? She's doing relatively well.
Good, good.
Her friend that wasn't taking it seriously because he thought he was going to be fine, he's in the hospital on oxygen right now.
Wow.
So for those of you out there thinking, I don't really have anything to worry about, you don't know for sure. You just don't know.
Mm-hmm.
You don't know how your body's going to react to this coronavirus. You might, even if you are a very young, healthy person, like the case of this young man that's in the hospital right now, have a very adverse reaction that even you were not anticipating, which is why it's important not to have COVID catching parties.
Yeah.
I think that this public service announcement falls under the category of, lo pendejo se paga parte. If foolish actions will result in foolish, consequences. And I don't think that there's anything that illustrates that better than this video that I share with you today. This is a man walking down the street. He decides he's going to try to kick the pooch.
Huh.
Take a look. He decides he's going to kick that dog.
And he misses and falls down.
hits his head
Ouch,
pretty hard,
yes.
too.
Oh.
This is why the dog just barked at him. It looks like the dog barked at him.
Yeah.
And then he decided he would kick the dog.
Oh, boy.
So, stupid is as stupid does. And for every action, there's an equal and opposite reaction. So make sure to wash your hands. Make sure to be kind, gentle with one another throughout the rest of the week. Love each other. And thank you for being with us here on A Mexican Crossing Lines with your host, Cindy Gomez-Schempp.
And Duke Gomez-Schempp.
You've been listening to 88.1 FM, KPPPLP, Fargo Moorhead, where we are adding local color to your airwaves. Good night and God bless.